Welcome back to Ethically Sourced. Today, I'm so privileged to be speaking with Dr. Kevin Simon. Good to have him back on the show.
Yeah, hey, it's good to be back. Didn't think I'd be back so soon.
Yeah, we're this week we're going to be talking about a pretty challenging topic, but one that is timely, one that's relevant, and one that affects a large percentage of the population, both inside and outside of healthcare. We're going to be talking about sexual harassment, sexual misconduct in the healthcare workforce.
Yeah, this is very timely. I think, unfortunately, there's a lot of there are a lot of cases, both nationally and then I'm sure locally for myself, locally for yourself, where we know, people that are on both sides of a circumstance related to sexual misconduct, and it's in our training, it's actually something that is touched on. I'm sure in residency and in fellowship, we all attend, some kind of didactic or session about, inappropriate language,
right,
and relationships. But it's really not. I don't think it hits the mainstream enough unless something bad is happening.
Yeah. I think once something bad happens, then everybody doubles down and it's damage control. But I think it's something that we should really be proactive about in teaching, starting in medical school. A lot of stuff starts at home, to be honest, but in the professional world, we've got to be more proactive about getting rid of this culture.
Yeah, no, it definitely does start at home, but yeah, in terms of the professional nature, I think, unfortunately, there are a lot of systems that are still in place where hierarchy is an issue. And anytime that there's this hierarchical nature in environments, people that are in positions of power tend to at times, abuse that power. So it is something that we definitely, I'm looking forward to the conversation that we're going to have today.
Yeah, well, let's start with the past and how we got here, right? There's a perception within medicine especially, and it's perpetrated by different platforms and the media. I have on my bookshelf House of God. I hadn't read this really until I was halfway through residency, but it's a book that's on the back of the book. They say this is one of the first unglorified, uncensored portraits of what training is to become a doctor. It's been hailed as one of the most important medical novels ever written. So I read this. I started reading this as a resident. And have you read this book, Kevin?
Yes, I have.
I was honestly taken aback and appalled at the overt sexuality in the book, the misogyny, the culture that is perpetrated, the way they describe the nurses and other female physicians and staff. And I was just kind of horrified that this was a book that had been encouraged and lauded by so many people.
Right. So, if you think about who's the author of the book, what is his position in general society, the book is written from, the author himself is a male, right? And so I think it is written from the lens of who is the doctor. And so the stereotypes that are written in it, and also this is not, we should look this up actually. In terms of the publication date, right? It's not the 2000s. We're talking about a time that's way predates, Me Too movement. And so that's what was normalized at that time. I think if we look at when the book was published.
So I'm looking at it right now. 1978 was the initial copyright.
Right. So 1978. And if we think about the larger cultural context at that time, right? So we're talking about on the back of civil rights movement was the women's rights movement, right? And so that's ripe in the 70s. And so I think when you read some of the text of the book and you hear, or I should say, read how women are described, it's not surprising how they're described at that time, because obviously that book could not be written today in the same way.
And on top of that, you have the practice of medicine, like you mentioned, predominantly male field. I think is it still predominantly male
Yeah, so what's shifting now is medical schools, and so I think one of the last AAMC reports that I'd read, women were 50-50, if not a little bit ahead of men in terms of entering medical school. But in terms of practicing physicians, for the vast majority of fields, maybe even except OB-GYN, which only shifted maybe the last 2 decades, most fields are overpopulated with men.
Yeah, so we have this history of paternalism both in medical practice as well as on the administrative and the practice side of medicine, and that's been able to perpetuate this culture. I mean, the culture thrived back in the day, and fortunately, we're starting to make some progress in this area. There's still a lot of progress that needs to be made.
Yeah, even thinking about other mediums that highlight medicine. So House of God, that's a narrative. You have Grey's Anatomy, which is, someone's going to correct me, but like season 22 or 23 or something. That when it first started and up until this part of last season, a lot of the dialogue and visual imagery is of certain types of relationships, sexual relationships that are happening in the hospital. And, the dynamics of resident versus attending, or resident, attending to resident to medical student attending. And so again, it shows up time and time again that relationships are difficult to navigate, at least again in the healthcare professional field. And this is why it's really critical that we talk about these things in training and beyond. It can be very difficult to know how to approach someone depending on where you are at the time you're present in the hospital or in the clinic, right? Again, trainee versus early career versus in residency versus medical student. It does make it very challenging.
We can fast forward to the present and talk about reality. For me, I see these sexual harassment and assaults and misconduct kind of they happen kind of like racism or microaggressions, and the fact that you don't walk in to the hospital expecting to be called outside your name. You don't walk into the hospital expecting to be assaulted or talked to inappropriately. And when the situations happen, you have a perpetrator, you have a victim, sometimes you have witnesses, and a lot of the times, people are kind of shocked or don't necessarily know what to do in these situations.
Right. And to that point, no one certainly walks in to work assuming that that's going to happen to them. And because again, the dynamics of power, if you're a recipient of a questionable comment, who do you go to if that person is someone more senior than you?
Yeah.
And oftentimes I think that happens. I can tell you a personal example of someone who came to me to say, this happened, Kevin, I'm not like lying to you. And I believed the person, it was a female. And I wasn't even sure like whom the person should go to. And they weren't sure either, right? Like, and we were both knowledgeable of the system, but where the perpetrator was in terms of hierarchy, we eventually did reach out to, again, programmatic players in the hospital system that we were in, but it becomes something of mental gymnastics. Because you're just like, wait a minute, I'm on a rotation. This person's maybe going to write a letter for me. And so it can become really challenging in these training situations. And then when we get outside of training, I think, again, what's allowed in the culture versus what's not allowed. So again, flirtation, what does that really mean? And I see how these circumstances happen, and I suspect that oftentimes when someone is told, I didn't appreciate that comment you told me, the person who maybe made the comment didn't even know that they made the comment and that it was perceived that way. I think that's the other, unique challenge to dynamics of I say a comment and the recipient hears the comment differently than what it may have been intended to be. I think that's something that you often hear in these kind of dynamics.
Yeah, I was going to ask you if you'd ever witnessed any of these, because I will say I've seen a couple, I've heard some stories when I was in training. Like there was an old attending that was no longer with the practice, but especially in anesthesia, it's kind of a breeding ground for, anywhere that the trainees are isolated and these events can occur. So, with intubations, when you're learning how to intubate, sometimes, it's almost like, teaching somebody to play pool or tennis where you can creep up behind them. And allegedly there was an attending who would, use that time to kind of rub up on the female residents. Person was long gone by the time I made it to residency, but those stories remain.
Right. If we ask a lot of people, male, female, if they've heard of or known or seen, more likely than not, greater than 50% of the people that we're talking about healthcare specifically have seen these kind of instances happen. And, to your point about like the microaggressions, right? If we parallel that, it can be, right? So the operating room, someone's like creeping up behind you. That's one, right? But then there's the, team huddle or rounding or sleights of hands, in terms of, again, pre-COVID, placing your hand on someone's back. There's a lot of subtle things that can happen that I think, the white coat, if we're talking about physicians specifically, again, this power dynamic that occurs, and truly people not really knowing, okay, who do I go to when it's like the head honcho supposedly of the division of the unit making this crass remark or touching me inappropriately. And I think there are cases that have occurred more recently where it can be even in times of I'm outwardly acknowledging that something has happened to me, and still yet the way that these systems work is really hard to be a person who has had something happen to them feel empowered to navigate the system for themselves. It really is a challenging situation that people find themselves in.
Yeah, to the point you made earlier, and my point, not knowing where to turn. So in reading up for our discussion, I looked up, because I remember this being referenced, Title IX. I didn't really know what Title IX was. I knew it had to do with, like, I think of sports teams and athletes, but it's Title IX deals with it's an educational amendment, and it protects people from discrimination based on sex and educational programs or activities that receive federal financial assistance. And basically, this is the governing body for people that are victimized, because these residency programs are receiving federal money, from my understanding. And if I'm wrong, please correct me, send me an email, send me a message or whatever. But under this Title IX protections, that is the ultimate avenue to file complaints. You can go online, the Department of Education, or Google Title IX, and it has a rubric for how you can report these instances of sexual assault or whatever the case may be. So that's one way. Obviously, ideally within your department, there should be somebody. I believe there's mandatory reporters and other resources to use at each individual residency program or school or wherever you happen to be. But if you don't feel comfortable going to anybody at your immediate work area, you can always go online and file this report. Caveat being, usually it says these complaints must be filed within 180 days of the last act of discrimination.
And I think even that, the fact that we're highlighting it is important, because again, oftentimes the moment of the act, much like a microaggression, the moment you may or may not recognize it as inappropriate. And it might be, you have a conversation with a colleague or you have a conversation with a friend, and you're like, this thing happened, and someone might have to say, like, that's not okay, right? And so the same case for me and my friend, I was like, I don't think that's kosher, and that's when we really kind of up the ante in terms of like, okay, well, what are we going to do about this? And so that point about it has to be within several months of the last act. I think a lot of times when things are traumatic, you may not realize, wait, I have a space to go to, or even want to process it. As I'm thinking about this in terms of acts that are kind of heinous. So within my field of substance use, there are a lot of people who I meet who, in the context of drinking alcohol, and oftentimes there can be, depending on how much you drink, this like blackout phase, which is, i.e., the hippocampus just basically turning off and saying you're not going to make any more memories right now, but your body's still moving, right? And I think this is where it gets really tricky, in that the limbic system's still going, so you're walking, you're talking, you're responding, and this is when the hippocampus is off, that next morning you're like, how did I get back here, right? And there are a lot of scenarios where, in that phase, and this goes back to the whole he said, she said, suggestive court cases, where, specific to alcohol consumption, there are times where folks who have had something bad happen to them will not know and need corroboration, right? And so, again, back to the friends, need a friend to say, no, like, this happened to you, Kevin, or this happened to you, Stephen. And even in normal workplace environment, I think this is where the culture of having, trusted colleagues is very important, because you have to be able to have someone to talk to say, this person did this thing to me, or this person did that thing to me. What are your thoughts? And hopefully folks have enough, trusted friends where they can say, yeah, that's not okay. I think oftentimes we should be able to just, on our own accord, be able to navigate these systems. But sometimes, it's pretty difficult to navigate, even when you're, again, in the field. But again, depending on where you are on that ladder of hierarchy, it can be very difficult.
Let's get more specific. I think we know the egregious, right? We were talking earlier about this physician, Dr. Newman, who was in New York, who legitimately sexually assaulted multiple patients in the emergency department. Fortunately, he was brought to justice, and he actually, we were talking earlier, he only got 2 years in jail, I think, was the ultimate outcome. But that's egregious, right? Sexually assaulted somebody. What about the gray area? I think that's where a lot of folks have trouble and struggle with.
Even before the gray area piece, right? The reason that Dr. Newman was brought to justice was there was a patient who was in the semi-conscious state, anesthesia, you guys.
Hey, man. You got nothing to do with this.
No, you didn't have anything to do. What I'm saying is she was under medication, and as she was coming out, she recognized, wait, something's happening here. So yes, I apologize to all anesthesiologists. You guys, an awesome job. She happened to be a woman of color, and it took a lot of unfortunate investigation in order for him to get brought to justice. And I think one of the things that we can't dismiss is who is saying, they've been violated.
True.
Because I think oftentimes, unfortunately, depending on the victim, who we're calling victim, or those that were violated, they can feel, again, less empowered depending on what's their gender, what's their demographic. I just think that that's something important to mention as we're talking here. But yeah,
I mean, specifically because women of color are probably the most vilified or victimized groups in our society.
Right. So again, our like work field environment is such that these things can happen, and this becomes an argument, right? does the worst thing that a person does that quote unquote cancel? Does that cancel their career? I think this is beyond the scope of our episode here, but it is something like, can someone come back from that? And his was specifically to a patient,
yeah,
right? To multiple patients. So I think this is right for further discussion. But it really is one where we definitely have to continuously have these conversations, so that way these things don't happen as often as they do, unfortunately.
So when it comes to navigating these gray areas, right? We know the black and white, what is and what is not sexual harassment, but how do we navigate those gray areas of interpersonal relationships at work?
So I think this is where personal space. So a couple of things I think were formerly gray areas that I think just need to be very black and white. Not touching people is like a black and white. That's a very black and white thing. Like the whole idea of personal space. And I will even say from my own experience, there was someone same gender as me, right? Same gender as me, who I patted on the shoulder, but the person felt uncomfortable. And so, some number of weeks later, I'm asked about like an incident. I'm like, an incident? What happened? And they're like, oh, hey, did you like say hi to someone? And they relayed what I knew. I was like, oh yeah, no, like, I was just saying hi, right? But again, it's not about what my perception was. It was what's the perception of the other person. So I think it's very important when we're having these kinds of conversations, or we're talking to trainees or talking to mentees, is you cannot, invade someone's personal space. And personal space includes like telephone, meaning, text messaging people, right? You can't invade that space unless someone overtly invites you into their space, right? And in terms of overtly inviting someone into that space, right, there's always like an appropriate place and context for that, right? Ideally, if I see my wife in the hospital, yeah, I'm going to give her a kiss, right? We're married. I think there is certain protective spaces for people, and one, their personal space. You shouldn't touch anyone unless they again have overtly invited you into that space. And then the phone piece, right? I think we had probably talked about this. Never in the history of a phone has it been ever appropriate to send certain pictures in a phone, right? Like that's not, it's just not ideal.
I agree completely. I think, and to get at what you're referencing in terms of like public displays of affection, I think a lot of times what it comes down to for me is the newspaper headline test. So, and this is true for a lot of medical ethics. So if what you did was in the front page of the New York Times, would you be okay with it? So if you got called to the office for kissing your wife at the hospital, that would be a fairly benign conversation.
Right.
So that's one way to start framing stuff. So number one, hands off. I work, I don't touch. I have a couple really good friends, hang out outside of work, coworkers that I intentionally touched this person's shoulder like a couple weeks ago. Otherwise, I do not touch anybody at work. Ironically, two of my coworkers, like one like casually touched my shoulder, and I was like, "Whoa! Like this is weird," because I am so I don't touch anybody at work. I think one thing that helps trainees, it needs to be said, don't fall for the trap of double entendres. Did I say that right? I don't know. Non parlez-vous français? Entendre, right?
He did say it right. It is a double entendre, yes.
Don't do it. Don't do it.
I'm sure some people will listen to this and say, "And who are these guys? They're, so PC." But it's right? Like, would you want that on the front page paper? And I think this also, in terms of talking about racial differences, right? I'm a 6'3" black guy. Right? It is different. It is different when I do something versus someone else.
Yeah.
And I remember even in training, in medical school, I'm on my OB-GYN rotation, and I legitimately am standing at the doorway, and there's a nurse who is changing the IV line, right? And I had alerted her like, oh, it's buzzing. The person would like it changed, and I'm just watching, literally just from the door watching. 2 days later, Stephen, I'm in the clerkship director's office and told, oh, did you intimidate someone? I was like,
What?
intimidate someone? And if most people know me, they're like, that was not intimidating. But my presence, who I look like, what I look like, that definitely had a play in the interaction that the nurse, who happened to be a female, because there are male nurses, perceived of me, right?
Yeah.
And so this is subtly different than obviously, a misconduct, but definitely when you're a male of color, the whole thing that we're talking about, gray area, like truly black and white, like do not touch people, that has to be, one of the tenets of when you're moving in the space of healthcare and just generally workplace environment. Our culture is not yet at a place where these subtle nuances are allowed to be nuances. And so for myself, just like you're like, hey, I don't, it felt weird for someone to pat me on the back. I think that's how we have to, particularly as Black men, have to kind of navigate some of these environments, because normal behavior that we do might be misperceived.
Yeah.
So, now later on, something remotely intimate, it can definitely be misconstrued.
Because there's a wide variety of people that listen to this podcast. I know most of the Black males that I know are familiar with this. For people that may not be familiar, there is this trope of the angry Black male, or Black men are intimidating over brutes, or talking at a normal volume is perceived as yelling, or the whole King Kong kind of trope. And it's something that permeates society, if not in an overt way, in a subconscious kind of implicit bias way, that it's there, that you never know when that's going to trigger somebody else. And like you mentioned, you're going to be perceived as something that you're not.
There was to bring it to recent times, a couple of years ago, LeBron James had a cover shoot where, he's dribbling basketball like he is, and the model happens to be a white female. And immediately people were like, oh, this actually reminds me of like King Kong and Jane. And it's because, again, this idea of, particularly for Black men, and we can go back historically to Jim Crow, pre-Jim Crow, right? Sexual predator, right? And so that's like subconsciously out there. So when misconduct happen, or there's questions about misconduct, that undoubtedly is existing in the atmosphere. Again, these kind of conversations don't normally happen. Like, I can tell you, I'm PGY 6, I
Lost
believe.
count.
In all of the times since intern year that I've had didactics or sessions about this particular topic, it generally is a very sterile conversation. And these kind of nuances and subtleties are not necessarily brought up, particularly talking about race, gender. So I think it's good that we're trying to have this conversation.
Yeah, I think and going back to the black and white, like Kevin, did you know anybody that had a sexual encounter at the hospital?
Oh,
consensual sexual encounter at the hospital?
A consensual one? I am aware of people who have had consensual sexual encounters, much like you see, you were talking about earlier on Grey's Anatomy and those other TV shows. Yeah, I know people that have engaged in that. And again, should that be happening? It is. To your point, right? Like New York Times, would you be okay with that being known? A lot of people probably would not. But it's very different than New York Times. Two people, consensual relationship in their house. Like, well, it's their house. Okay. Workplace, much different, right? And I think that's the actual thing, right? It's a workplace.
Yeah.
But thinking about the hospital is a weird, workplace, right? Most workplaces pre-pandemic, because a lot of people obviously are working from home, most workplaces don't have a call room, right? Like most workplaces don't say, oh, you can also sleep here, right? So I think that's where these kinds of things again become gray, right? Because it's like, wait a minute, I'm at work. Oh, but there's a
become
bed.
gray.
Oh, the person I am in a relationship with is here. That doesn't happen at a traditional, office.
Fair enough. The point I'm making is you cannot excuse having a sexual encounter at your place of work. If you get caught, you got some explaining to do, and you could lose your job.
That is true. And so you said if you get caught, and again, I never asked any of the people that I know that have done this. I actually have no clue, like what would happen at the respective hospitals that we've trained at or been at if in the call room. This is I am open to hearing answers here, right? What happens if you are caught in a consensual act in the call room? That is actually that's an actual event, right? But I think to your point, well, if you're on call, you're working, right? Right? We're not saying you're off of work. We're like, no, you're on call. So in theory, most people, and we've been seeing this in the pandemic, if something happens, whether the Zoom is on, right, or the camera is off, sexual act shouldn't be happening like during times of work. I think that's a fairly black and white statement. Although I'm sure someone will say, no, that's actually not true.
I don't know that ethically I have a problem with it if you're not working ethically. But what you're subject to all the terms that are on that contract, right? As a resident or a fellow, you have a contract. Right. And somewhere in there is the HR department. And so technically, I'm sure there's a clause that in some way, shape, or form, if that was brought to the light, you could lose your job.
Talking about appropriate behavior, right? Just like, and I appreciate that we're having this conversation. I think just much like at the hospital, again, we're talking about one sphere of healthcare, but at the hospital, if you are on call or shortly after call, right? Technically not quote unquote working. Again, headlines.
Yeah.
You couldn't, drink alcohol, or you couldn't have, marijuana. Like there's certain things you would certainly think, oh wait, this is not appropriate to do here. And so again, the engagement in certain acts probably should not occur. But again, our culture, House of God, ER, House, Grey's Anatomy, right? They kind of profile these things. And so you're then in this environment, like, oh, yeah, I saw this, and I'm sure people don't, one-on-one say, oh, yes, Meredith Grey did this, I can do it. But I can see how people can be confused about, what is legal versus like what's not legal, right. What's ethical, what's not.
Yeah, I mean, consensually, it's legal. Ethically, I personally don't have a problem with it. And I think it's, if you know the risk of the behavior you're engaging with, specifically as it pertains to your job, those are, I knew people that, got it on in call rooms, but I was honestly always too afraid to lose my job. So, Kevin, the last thing that I would say is be very cognizant of hierarchy. So you've got medical students, residents, attending physicians, and dating down, not to be rude, but as an attending, you should not be dating somebody that you're filling out their evals or somebody that's subject to your authority because of that power dynamic. That's something that even residents, with your medical students or junior residents, that is just never going to look good if you have to explain that, and that person may feel under the sway of that power dynamic, and it may not be fully consensual.
I do agree with that sentiment. And as I agree with it, I also know of people, and I don't ever think they were in a relationship like when they were on the rotation per se, but I do know of and have seen, resident to medical student, because some residencies are super long, right? And so I do now see people and have friends who are in marriages and in relationships, but I think they were strategic in, making sure that you're not going to be the student that's on my rotation, or you're not going to be a student that's paired with me. I think that that's appropriate and ethical. And I think, to this like ending conversation, one of the things that we often hear about, or at least I've heard, is some people say, I'm just not going to, engage in any kind of relationship, like a consensual relationship, with people at work. And on one end, I do understand how people say that, because I don't want to do that where I work. But then at the same time, the other side is like, where you work is, particularly in healthcare, you meet people and you start to be around people often, and more than likely, just based on proximity, you're going to like people that you're around, right? And so it's why, med students who didn't know each other, all of a sudden they're around each other studying a lot. They get in a relationship, and by fourth year they're applying to couples match together, right? Or get engaged. It's really that proximity. So I think one of the things that if we could say, hey, one of the other tenets, right? So there's the newspaper headline is one, recognizing what's black and white is two. I think another one would be, things have to be consensual. And that is, it has to be an open, clear, transparent conversation that you are having with someone else about the nature of the relationship. And I think that's very important, because innuendos, double entendres, it leaves, when there's ambiguity, it leaves too much open. And I think this is where we really have to ensure people are really having overt, intentional conversations about what's the nature of this relationship that we are having, so that way, things that are unwanted don't happen.
Absolutely. I think you nailed it.
Well, this was certainly an interesting conversation, much different than our first one. But I appreciate having the opportunity to kind of think about these things and talk about these things out loud, because oftentimes it's not done, particularly by two guys.
I know we're gonna get some messages that we got to add some female representation, which I'm open to. Ladies, if you want to jump on and have this chat, please feel free. I'm open to having these discussions with whoever, and I'm so glad that Dr. Simon has come back. He's a psychiatrist and just spent so much time studying the human mind. I love to pick his brain literally and see what he thinks about these issues. Kev, I totally enjoyed this conversation, and I thought it was interesting how it shifted from the beginning, which was obviously wrong, the way medicine is so paternalistic and misogynistic, to we ended up talking about the consensual relationships and aspects and what to do and not to do in medicine today. And I think that kind of highlights where people get into trouble, because if you're a sexual predator, you're going to listen to this you probably won't listen to this podcast anyways, and you're going to be doing whatever, and hopefully will be brought to justice and don't have a place in medicine. However, for people that struggle because they get stuck in that gray area between what is consensual and what is not consensual, and what somebody thinks is consensual but is not truly consensual to the other person, I think is where a lot of stuff starts to go sideways.
I think that's very true. And again, this idea of how we communicate. I am a psychiatrist. How we communicate is very important. How we relay our messages. Again, text messaging, conversations, right? Like if you really want to ask someone out, ask them out. It's just so, in our culture, in our world, we really do have to be very overt with things. Again, so that there's just you try to minimize risk, and you try to minimize opportunities for negative consequences to happen. And I think, us talking about, having transparent conversations potentially could help someone in terms of not being in the gray area. Because when you're in the gray area, then, it is an unopportune space to be in. And so, we're trying to mitigate risk.
Yeah.
Here.
Kevin, thank you so much for coming on. I do want to shout out part of what helped start this conversation, and Kevin jumped on, was like, hey, we should definitely talk about this on the show, is the hashtag #SpeakUpOrtho Twitter account. And I think it was started by Dr. Nancy. She's an orthopedic surgeon out west. And she started this, I think it was her, but basically you go to Speak Up Ortho, and they're putting out anonymous statements and narratives from people who are victims of harassment in training. And you read some of these stories, and if you think Kevin and I were blunt, like these narratives really talk about what people are going through and how people are being harassed, taken advantage of during their training or even during their career. So I highly recommend you follow that hashtag, go support this account, and open your eyes so you can see these behaviors and help get rid of these malignant behaviors in medicine as well as other fields. Cool.
All right, man.
That was